Nearly 1 in 4 U.S. adults live with a mental illness. July honors National Minority Mental Health Awareness Month. It raises awareness of the challenges that affect the mental health of people in racial and ethnic minority groups. And today we are joined by Dr. Nanette Smith-Funderburk with the Social and Emotional Learning Group. So first, thank you so much for joining us today.
Thank you.
Why is it important to recognize National Minority Mental Health Awareness Month, and what does it personally mean to you?
Well, I think to acknowledge it just acknowledges that while there are so many similarities about just people in general, there are areas where systems and situations impact us differently. And so I appreciate the acknowledgement. I appreciate it being recognized on a national scale that we're here, but we're slightly different and we can contribute in different ways, but hey, acknowledge that, you know, we have some ways in which we can be challenged differently.
Absolutely. And what are some of the unique mental health challenges faced by communities of color, particularly in the Black community?
Definitely, the first thing I think of are microaggressions. Those are the small things, you know, oh, wow, you've changed your hair again, or, oh, you know, how often do you wash that? Or, you know, things that can seem like, okay, where did that come from? And there are 1,000 more, a million more a million other ways that it could come out. But those things come out and they strike us as, oh my goodness, why is that question being directed at me? And is that type of question being directed at others who are around here as well? So it can be a little daunting. It kind of put you in a spotlight that you don't want to be in.
Absolutely. And how can we as individuals help normalize mental health conversations in our own cultural communities?
Well, I think just having a conversation like this is a great step. In addition to that, we need our leaders to, and when I say our leaders, I mean the leaders that look like me, to step up and say, hey, you know what? There's some mental health issues that I have experienced, or I am experiencing, or someone in my family has experienced this, or I have used this resource or that resource. Because what it does is it normalizes that, you know what, anybody can have an issue and go seek help for the issue, and you're likely going to be much better for it.
Sure, absolutely. And there's still stigma around mental health in many minority communities.
Right.
How can we start breaking that stigma and encouraging people to get out there and seek help?
Well, you know, there are, first of all, again, having this type of conversation is very, very helpful. And the leaders as well, making sure that they're making statements. Also, we want to address some of the stereotypes that are out there. While they can seem positive in some ways, like the strong Black woman or the strong Black man. Yes, it's great to have strength, but in order to have strength, you need a place where you can safely build or rebuild yourself, because there are days that we're getting knocked down in ways that other people are not, simply because we've walked into a place and we look different. And I can imagine that those who have not experienced that are kind of thinking, well, how does that happen? Well, how are you treated differently? And that's where those microaggressions pop up. You know, someone clutches their purse as you walk in. Someone makes sure their door is locked as you walk by. Those things are hurtful over time, and as you experience it over time, it can bring up other emotions as well that need to be dealt with.
Sure, which is why awareness is so important. And how can people find mental health resources, especially through you and your partnership? How can people go toward finding those steps and resources?
Yes. Well, you know, you always want to look online. There's Dr. Search Engine out there, right? And just insert the name of your favorite search engine. So you want to look around. Psychology Today has psychologytoday.com has some great resources. There is also cliniciansofcolor.org that has some great resources out there, and some clinicians that you can check in with. Right here in Greensboro, there are, of course, we are right here in Greensboro. There are lots of other places. There's the hospital, Cone Hospital, there's Guilford Behavioral Health, there definitely is Family Services of the Piedmont. So there are places out there who are right there ready to offer help. We just have to step out there and say, hey, I'm ready.
What is, when you do get an opportunity to get in front of a therapist, what is a great first icebreaker question, or what can that first conversation be like? Because there might be many people who might struggle to be transparent with what it is that they are going through.
So a great question for the client, the patient, the person who has come in?
Or the person who might be the client who might be asking a therapist or something of that nature.
You know what, just go in and be honest and say, this is my first time here, or I haven't been in a very, very, very long time, and I don't really know what to expect. I'm a little, I don't know if I should trust you. Because we've heard it all. So you're not going to offend us. So go ahead and put it out there if you're nervous, because then we can address that. We can address, if we maybe are doing some things that remind you of that person who seemed to act a little funny towards you in the first place. We can say, okay, you know what? I'm sorry that I did that. Please forgive me. We just come right out with it and say, let's put the elephant on the table and address it so that elephant can go by its own wayside.
Absolutely.
And then have the real conversation.
I love that. Transparency is important.
Absolutely.
Just be honest and be open.
Be honest and open.
There
That's
you
right.
go. Thank you so much for joining us today.
Yes.
And remember, if you missed our entire conversation, you can find it on our website, WFMYnews2.com.